Hello, everyone. This is Zohir Chaudhary, and today we will discuss global health security, how this evolved, and the birth of international health regulations. So, the international health emerged primarily as a response to pandemic threats perceived as coming menacingly from outside Western Europe. Thanks to the new steamship and railroad technology, increased and rapid world commerce and travel allowed cholera and later yellow fever, as well as bubonic plague, to leave their traditional endemic sites in colonies and developing countries and reach the economically advanced nations of the West. Physicians, merchants, and politicians converged on the need to protect their populations, businesses, and territories from epidemic outbreaks by modernizing and standardizing quarantine and other border health controls. Cholera is a disease marked by the frightening and dramatic onset of cramps, vomiting, convulsions, and diarrhea. Cholera had long been restricted primarily to India, but beginning in 1830, it started spreading in Europe, and Britain experienced its first epidemic in 1832 when 52,000 people died. So the cholera pandemic started between 1826, that initial phase, and lasted until 1837 or so. And here we can see some painting depiction of various artists that shows the death from cholera in the mid 19th century. The next wave of cholera reached Europe in 1848, and it started spreading from 1846 onward from different places, and in by 1848 it was spreading from Norway to England, Spain, and the Balkan countries, and North Africa was also affected when Muslim pilgrims from cholera rampant Mecca returned to Egypt. And during this wave, cholera caused the death of 53,000 more people. 1 year later, it was carried by boat to New York and New Orleans in the United States. At that time, North Americans shipped large amounts of water around the country, often up the Ohio and Mississippi rivers. Since cholera spreads through infected water, this led to some bad outbreaks that claimed around 150,000 lives over there in the United States. Cholera reached China and Japan also in the early 1950s, and the Philippines and Korea toward the end of the decade. These countries went on to have many more outbreaks before the end of the century. Many more countries were affected, but the most significant outbreak occurred on Broad Street in England, which is Broad Street in London, a part of in England, in 1854. Only 616 people died, but John Snow found out that cholera spread through contaminated water. And in here, you can see this memorial well, where it is dedicated to Jon Snow. And this street in Broad Street also, I think, has a museum where you can see. Um, and and this script from here, this plaque, it's located over there as well. And you can visit Broad Street in London, and get to know this historical discovery. So the cholera epidemic that hit Europe in 1830 and later in 1847 and 48 and onward made apparent the need for international cooperation in public health. In 1851, the French government organized the first international sanitary conference in Paris to discuss cholera. We can trace the beginnings of global health security regulations to this specific conference in 1851 in Paris, as international sanitary regulations were adopted right at that time. In 1948, WHO was created, and 3 years later, in 1951, the WHO, or the World Health Organization, issued its first infectious disease prevention regulations, known as the International Sanitary Regulations. This ISR, also known as ISR 1951, provided a single set of rules to help member states control the spread of quarantinable diseases. So the International Sanitary Regulations, or the ISR of 1951, focused on 6 specific diseases. One was cholera, second one was plague, third one relapsing fever, fourth smallpox, fifth typhoid fever, and sixth yellow fever. And these were reportable. So by the 22nd World Assembly in 1960, World Health Assembly in 1969, they adopted and consolidated and also revised this ISR, or the International Sanitary Regulations, from 1951, and it was renamed as International Health Regulation, or IHR, and this is known as the IHR 1969.